Hi, this is Dr. Latasha McElwain, and today I am going to be giving a anxiety and obsessive compulsive disorder overview. The purpose of this presentation is for supervision, and it's just to make sure that everyone have a good grasp and understanding of anxiety and obsessive compulsive disorder. When we're considering and talking about anxiety, the overview of anxiety is pretty much anxiety is a type of mental health condition. Basically, experiencing occasional anxiety is a normal part of life for everyone. Often, when it comes down to anxiety disorder, it kind of involves more repeated episodes of sudden feelings of intense anxiety and fear or terror. And that usually reaches a peak within minutes. And sometimes individuals may have a panic attack. So, a lot of times when we're talking about anxiety, a lot of people like to say anxiety is normal. It's a normal part of life. And they are correct. But a lot of times when things are getting to be too overwhelming, such as people worrying about money, worrying about health, worrying about family problems, and things of that nature, that could lead to some concerns of having a more episodic type scenario where anxiety disorder may, in fact, be diagnosed. So anxiety just doesn't go away and it can get worse over time. So that's how we kind of realize that those symptoms are more intense, or those symptoms really interfere with an individual's daily lifestyle or daily activities, such as, job performance, school work, and having relationships. So a lot of times when we're looking at excessive anxiety, it'll also make you want to avoid different things such as work, school, family, get-togethers, and other social situations. So in those social situations, things can also trigger your anxiety where things can get worse, or you can, exacerbate your symptoms. So with that being said, when we're talking about anxiety, we want to make sure we understand that there are a few types of anxiety. So, the several types of anxiety that there are is generalized anxiety, panic disorder, social anxiety disorder, and then various phobia related disorders. So, occasionally, anxiety is okay to have in your life because we did mention that it's kind of a thing that happens in most people's lives. But anxiety disorder can be is pretty much different, and it's different because basically they're a group of mental illnesses that cause constant and overwhelming anxiety and fear. So anxiety, a lot of times, anxiety disorder goes beyond the regular I'm just nervous or I feel some fear. It starts to go into a more intense situation where the anxiety is interfering with your ability to function, your ability to continue on doing things you need to be doing. Oftentimes, sometimes triggering your emotions and basically overreacting sometimes to things that might sometimes trigger emotions, as well as a person could actually lose control. So if they can't control their own responses, if they cannot control their own responses in different situations, then that could be a concern as well. Now, when we're talking about what causes anxiety, for the most part, anxiety is one of those ones that really is not fully understood. Life experiences such as traumatic events and can actually, you know, help the anxiety to appear or trigger some anxiety. It could actually trigger the anxiety disorder in some people as well. So what we kind of realize is that people who are already dealing with anxiety, are already prone to anxiety. Sometimes, those are things that come about, and it's pretty much inherited traits can also be a factor. So when we're talking about anxiety disorder running through families, we talk about the genetics of it. So have worked with plenty of individuals where that has been something that definitely runs through the family. And I tell people a lot of times, if you have a real nervous an anxiety ridden individual, and they're around you, if you are at a point where, especially if that's your mother or your father or whatever the case may be, or a family member, a lot of times, a lot of those things that are happening around you, you end up realizing that, oh boy. And so we get down to the environmental stresses, we get down to you know stressful events that people have to live through, experience, see, anxiety disorder, including childhood abuse, neglect. When we look at anxiety, we talk about the brain chemistries and how pretty much it could be linked to, or may be linked to, some faulty circuits in the brain that control our fear and emotions. And that's something that can happen very young with a person, and it could happen relatively, if something really comes along in someone's life and really trigger it, such as a traumatic event. So a lot of times I tell people there are a lot of different things to look at when we're talking about the causes of anxiety, those environmental stresses, going back to that, talking about childhood abuse and neglect, also talking about death of a loved ones, especially close loved ones, and then being attacked or seeing violence. Those are other things that kind of, push people to that point where they realize that they're dealing with anxiety. Other things could be drug withdrawal or misuse. We're talking about medical conditions as well. We're talking about a chemical imbalance, going back to those brain chemicals again. And then we talk about the environmental factors, and then we talked about heredity as well. So moving right along, we're going to talk about anxiety symptoms, common anxiety symptoms, signs and symptoms. A lot of times it includes a person feeling really nervous, restless, or tense, also having a sense of impeding danger, panic, or doom, having an increased heart rate, breathing rapidly, pretty much sometimes hyperventilating, sweating, trembling, feeling weak and tired, trouble concentrating, thinking about anything other than the present worry. Um, Another one I see here is having trouble sleeping. That's a big one. Not being able to sleep at night, causing some intestinal issues, experiencing those concerns, having difficulty controlling worry, and then having an urge to avoid things that trigger that anxiety. A lot of times when we start looking at anxiety disorder, we did talk about several a little while ago, but now we're going to go a little bit more intense into them. As far as agoraphobia, that's when you fear or often avoid places and situations that might cause you to panic or make you feel trapped or helpless or embarrassed. Anxiety disorder due to a medical condition, an individual that may be dealing with some physical issues, intense anxiety and panic can come about. And then also generalized anxiety, and that one's more of a persistent and excessive anxiety and worry about activities or events. So a lot of times, even if they're ordinary or routine issues, for the most part, the worry is pretty much out of proportion with the actual circumstance. So they're kind of bringing it to be more bigger than what it really is. And pretty much a lot of times when we look at anxiety disorder, it also occurs alongside depression. So, all right. Panic disorder, another one that's, of course, involves repeated episodes of sudden feelings and intense anxieties and fear of terror. So basically, a lot of times the panic attack, it can peak within minutes, impeding doom. A person's feeling a lot of different things, shortness of breath. Person's also feeling chest pains, rapid or fluttering, pounding heart, heart palpitations. So a lot of stuff is going on there with individuals. And that's also, a big sign that the person might be having a panic attack. So panic disorder. And then select muteness is another one that consistently, this is a consistent failure of the child to speak in certain situations, such as school. It could be in, situations when they can speak, and they can speak in other situations, but in that particular situation they might not speak, such as at home with close family and friends. They may talk a lot or whatever the case, they may talk, but they may not talk when it comes down to different things like school. So this is something that can actually um, interfere with with an individual's school, work life, and social functioning. Um, Separation anxiety disorder, that one's a childhood disorder characterized by anxiety that's excessive for the child's developmental level and related to separation from parents or others who have the parental roles. So that's another one to consider about separation anxiety. Social anxiety, that's the social phobias. That one's also involving pretty much high levels of anxiety, fear, and avoidance in social situations, feeling embarrassed or feeling self conscious or concerned about being judged or viewed negatively by others. Another one is the specific phobias, and these are characterized by major anxiety when you're exposed to a specific object or situation and a desire to avoid it. So, phobia really provokes panic attacks in some people. If a person, saw something that they're really afraid of, for the most part, that could provoke, excuse me, a panic attack. So when we're talking about substance-induced anxiety disorder, this one is basically symptoms of intense anxiety and panic that are a direct result of misuse of drugs or taking some medication or being exposed to a toxic substance or withdrawal from drugs. Another one here is talking about other specific anxiety disorders and other unspecified anxiety disorders. Pretty much the term for anxiety and phobias that don't meet the criteria. So it's kind of like not specific, but we're seeing enough of it. But we're seeing enough that's going on, enough distress, but they still don't meet the criteria. So moving right along, talk about the factors of anxiety. So factors with anxiety, we have, experienced and talked about, we've talked about trauma in past supervisions, but risk factors that come about with anxiety is that trauma. So children who endure abuse and trauma, witness traumatic events, lots of those adults who experience traumatic events, basically a lot of trauma can help to develop. A person can develop anxiety disorder, stress from an illness. So if a person have a health condition, this can also bring on significant amounts of stress. I have met plenty of individuals that struggle with breast cancer and going through the treatment and everything, where it has definitely caused a increasing amount of stress, not only the increasing amount of stress of going through all the treatments and everything else, because of the pandemic, people fearful of getting sick while they're going through chemo and different types of treatment for their cancer. So that's definitely a stress concern. The stress buildup, a big event, or a buildup of small stressful life situations that trigger excessive anxiety. So, for example, the death of family, work stress, and then ongoing worry about finances. A lot of times I tell folks, when people have like 2 and 3 deaths back to back in their family, sometimes people have a lot of work stress going on and then finances on top of that. That could definitely cause some concerns. We're looking at personality. People with certain personality types are more prone to anxiety than others. And then thinking about other mental health disorders. So people with other mental health disorders, such as depression, we mentioned that often also have anxiety disorder. We talked about having blood relatives with anxiety disorder, basically anxiety disorder running through families. We also talked about drugs and alcohol, pretty much misuse. We talked about that. The history of mental health disorders, having another disorder, such as I mentioned, depression. And then the childhood sexual abuse, emotional, physical, sexual abuse, neglect, any of those things that happen in childhood can be linked to an individual having anxiety later in life. So we got to be mindful of that as well when we're talking about risk factors. Then again, it goes back into trauma. And with trauma, it does give us a good one down here. Living through a traumatic event that increases the risk of post-traumatic stress disorder. It can also cause panic attacks. So PTSD is one of the big ones that we typically hear a lot when it comes to the military and individuals coming out of the military, the level of stress they have to deal with. So that one is a big one also to keep in mind. Risk factors with anxiety, additional ones, negative life events. And we've talked about a few things early, things that happen early in childhood, like losing a parent, stressful or negative life events that occur. That can also increase an individual's anxiety, severe illness. We spoke about that a little while ago. Caring with someone who is sick can also cause some anxiety. It can also make someone feel overwhelmed and anxious. Substance use, we mentioned that as well. Being shy as a child. So, shy and withdrawal from unfamiliar people and places during childhood is linked to social anxiety in teens and adults. And then, of course, we look at low self-esteem. So negative perceptions about self, but yourself. And that could also lead to social anxiety disorder also. So we want to be mindful when we're talking about the complications with anxiety. So some of the complications that come along with anxiety, we mentioned depression being one of those other mental health disorders that individuals may also may occur with anxiety. And then we're talking about substance misuse. We're talking about trouble sleeping, having a great amount of insomnia, not being able to sleep, digestive and bowel problems, causing a lot of GI system concerns, and then a lot of headaches and chronic pain. I've definitely seen where migraines have set in with some people, chronic pain throughout the body, social isolation, problems functioning at school or at work, poor quality of life, and suicide. Some of the preventions when it comes to anxiety. So there's no way to predict for certain what will cause someone to develop anxiety, but we can only take the steps to help reduce the impact of the symptoms when it comes down to a person being anxious. So getting early help. Anxiety is one of those ones that when you're diagnosed with anxiety, the longer a person waits, the harder it's going to be to treat it. So getting early help is going to be great. Staying active, participating in activities that you enjoy and that make you feel good about yourself. Enjoy social interactions and having caring relationships. A lot of those things will help with lessening your worry. So doing things that you really enjoy doing. Avoid alcohol and drug use. That's another one because a lot of times alcohol and drug use can worsen your anxiety, making you feel a certain way for the most part. And if you're addicted to any of the substances, quitting can make you feel anxious as well. So, there are a lot of things there to consider when it comes down to that. When we're talking about anxiety disorder treatments, medication is one of the big ones that we start with. And a lot of times those are great ones to start with. Pretty much talking to your doctor or your psychiatrist about the pros and cons of medication is always good. And that's, to make the best decision that you can make for yourself if medication is where you're going. Antidepressant, sometimes moderate antidepressants, the SSRIs and the SNRIs. A lot of times, typically the first drug prescription to someone with an anxiety disorder are these. And pretty much examples of the SSRIs, Lexapro, we're talking about Prozac. The SNRIs would be kind of like your Cymbaltas and your Effexors. And then a lot of times we do look at some others as well. Another type of antidepressant is the I can't say the word, but I can't say it right now, but anyway, they want you to definitely be able to consider different type of medications. A lot of times when I treat anxiety disorder, I do not really look at medications first. I try to do a whole lot of talk therapy first. I jump in with talk therapy, and when I mean jumping in with talk therapy, meaning doing some things, some kind of some exposure therapy, some CBT and things of that nature, and we'll probably get into those in a few minutes here. But a lot of times your medications do help for a lot for the most part. I know the benzodiazepines is one that people do take for more long term. They can take it for a longer time. We have beta blockers, and then we move right on, continue with the antidepressants and things of that nature. Our Bruce Spar, what else? And then we get into our psychotherapy and our CBT. So a lot of the counseling, learning how to kind of deal with your emotions and how to handle your emotion, how your emotions affect your behaviors. Definitely talking with a trained therapist that has the specialties and able to listen to you and talk you through those feelings and even make suggestions of ways to manage your anxiety. And then cognitive behavior therapy, again, that's CBT, and that's a way of teaching you how to, turn your um, negative or panic causing thoughts and behaviors into positive ones. So just trying to rethink a lot of the things that's going on and put yourself in a different place. So, and a different outcome. Sorry. And then looking at managing anxiety disorder symptoms. So learning about your disorder. A lot of times I tell people it is great to start understanding what's happening and what's going on, and know your symptoms and knowing how to get around those roadblocks, and know when something is coming up. Don't be afraid to ask your doctor questions or your therapist for the most part. And you have to remember that you are a key part of your treatment team or your healthcare team. So you have to ask questions so you can understand what's going on to help be able to manage your symptoms. And then as we look at sticking to your treatment plan, whatever your treatment are, and a lot of times I tell people stopping the medication early or not going to therapy. That's not sticking to your treatment plan. Definitely want to make sure that you're, working through some things. Cutting down on foods and drinks that have caffeine. So coffee, tea, colas, energy drinks, and chocolate. Those things definitely are concerns because caffeine is a mood altering drug, and it does make for someone having symptoms of anxiety pretty much worse. So when we're talking about managing, also looking at cutting back on your use of drugs or not using alcohol at all, or definitely cutting back, or definitely not using any recreational street drugs. Of course, we like to say don't use recreational street drugs. And when it comes down to alcohol, either cut back your use or stop altogether. Be very moderate with it if you're dealing with anxiety. Substances will increase the risk of anxiety disorder, the symptoms, becoming more intense. So eating the right foods and exercising, so taking a brisk walk, like a walk or jogging or biking, help releases brain chemicals and cut stress and improve your mood. You can get better sleep if you are, trying to make sure that you're manage your anxieties. If you got sleep problems, you definitely want to be able to get more sleep. Follow a relaxing bedtime routine. Talk to your doctor if you're still having trouble sleeping. A lot of times they'll look at melatonin for individuals, or they'll look at different type of non-habit forming types of sleep aids. I'm a big person that definitely looks at when it comes down to anxiety and it comes down to uh, getting better sleep. I do a sleep hygiene. My sleep hygiene is about you know 8 to 12 hours of sleep at least 3 nights a week. I'll go down early and I'm in bed by 7 o'clock. And some mornings I'm an early riser, and sometimes I'll sleep right past the 8:30, 9 o'clock. And that's a part of my sleep hygiene, and just making sure I'm getting some good adequate rest throughout the weeks. All right. And then Learning how to relax. So, learning to relax is having some stress management in your life and some skills in your life. A lot of times you get that through understanding what's good for you and also talking with a therapist so you can come up with some different activities you can do like meditation or mindfulness, different things that can help you unwind after a stressful day. A lot of times I like to tell people I like to take a warm bath. I do a 20-minute warm bath, just to soak in the bathtub. I like to do that. I like to do that daily. So so just mentioning those things are good. And going to therapy, you'll hear those things a lot of times from your therapist, and different activities that people like to do. Some people like to go sit in a sauna for 30 minutes, or, especially if they have a home sauna. So there are a lot of different things that that might help make treatment better and make treatment work for you. Um, Keeping a journal, that's also a great one. Writing down your thoughts before the day before it's downtime for the day, or even um, if you want to write down your thoughts, in the morning before you leave, and kind of work through some of the thing and turning some of your anxiety your anxious thoughts through the night, kind of putting those down on paper. So it's kind of like helping yourself to be able to keep up with your thoughts and what's going on for the most part. Managing your negative thoughts, also being able to think positively. Instead of being so worried about different things, that can help to reduce anxiety. Of course, I always tell people that's easier said than done, but CBT is a big one that can help teach you how to redirect your thoughts. And then when we look at getting together with friends, having some time down, experience some different levels of activities that can be done, meeting up with friends, going play putt putt, or meeting up with friends going to play tennis, or meeting up with friends just to have some dinner. Those are things that sometimes can be very relaxing for you. Seeking more support. Some people do find it helpful and uplifting to talk to others about their experiences, especially when there's some of the same experiences with some of the same emotions. Definitely being in a self-help group is definitely not out of the question, but it's definitely something that would be helpful, and help you be more successful and achieve what you're trying to achieve as far as your treatment go. All right. So now we're going to jump into obsessive compulsive disorder overview. The obsessive compulsive disorder overview, basically, obsessive compulsive disorder is a long lasting disorder in which a person experiences uncontrollable and reoccurring thoughts, obsession, engaging in repetitive behaviors, compulsive, or both. So people with OCD have time consuming symptoms that can cause significant distress and interfere with daily life. So, excessive thoughts, obsession that lead to repetitive behaviors, compulsive, and then obsessive compulsive disorder is characterized by unreasonable thoughts and fears, obsession that lead to obsessive behaviors. A lot of times when we're talking about obsessive compulsive disorder in the overview, basically, you may try to, that person might be trying to ignore it, or they may be trying to stop your obsession for the most part, but it only increases your distress and anxiety. So ultimately, the person feels like they've feels you the person feels they are driven to perform obsessive I'm sorry, compulsive acts and trying to ease their stress despite the efforts of ignoring and getting rid of bothersome thoughts or urges. They keep coming back. This leads to the more ritualistic behavior. It's a vicious cycle with OCD. So OCD is kind of like, they're just, a lot of times I like to say they're like kind of like going around in circles with everything. So OCD often centers around certain themes. Examples of those themes would be excessive fear of getting contaminated or getting germs, or getting contaminated by germs. To ease your contamination fears, you may compulsively wash your hand until they're sore, chapped, and sometimes even you know cutting to the point where you see blood. Also, when we start thinking about what causes obsessive compulsive disorder, so the causes isn't fully understood, again, like we said with anxiety, but there are some main theories out there going with biological, genetics, and learning. So OCD, biologically, um, you know, may be a result of changes in the body's own natural chemistry and brain function. Genetics may have a genetic component that specific genes that specific genes have yet to be identified. And there can also be, and like I said, these are some theories. Learning, obsessive fear, and compulsive behavior can be learned from watching family members and gradually learning over time to do these things. So those are some of the theories. When we talk about what causes obsessive compulsive disorder, again, doctors aren't sure why some people have OCD. Stress can make some symptoms worse. That's why we kind of put anxiety and obsessive compulsive disorder kind of in the same when we're kind of talking about it. It's a bit more common for women than men, and the symptoms often appear in teens and young adults. So that's a nice little good bit of information or factual information to know. When it comes down to obsessive compulsive disorder symptoms, obsession often have themes, and we talked about a little that a second ago. Talk a little bit more about it. Fear of contamination or dirt, doubting and having difficulty tolerating uncertainty, needing things orderly and symmetrical. Um, Again, aggressive and horrific thoughts about losing control and harming yourself or others, and unwanted thoughts, including aggression and or sexual or religious subjects. Moving right along, we're talking about some of the symptoms. We're looking at the symptoms. This right here goes back to pretty much obsession and compulsive, typically with the themes. Again, we're talking about the washing and cleaning, we're talking about the checking, we're talking about the counting, we're talking about the orderly, we're talking about following a strict routine, we're talking about demanding reassurance. We're talking about OCD types and symptoms. So OCD comes in many forms, but most cases fall into at least one of the general category. So checking different things, as in checking locks, alarm systems, ovens, light switches, thinking you have a medical condition like being pregnant or schizophrenia. So always checking for things. Contamination, that one's the fear of things that might be dirty and having the compulsion to clean. So you may hear this called obsessive cleaning disorder. Mental contamination involves feeling like you've been treated like dirt. We talk about symmetrical and orderly is the need to have things lined up in a certain way. Um, when we're talking about rumination and intrusive thoughts, we're talking about the obsession with a line of thought, just kind of being in that thought process, and kind of, some of these thoughts can might be violent or pretty much disturbing, for other people to know about for the most part, or disturbing for the person also. Factors, risk factors. When we talk about risk factors for OCD, we're talking about factors that may increase the risk and developing or triggering OCD, including family history. Sometimes there's so much going on in families. Having a family history or other family members with the disorder can increase your risk of developing it. Also, stressful life events, things that are happening, those traumatic experiences, they can increase an individual's, risk for OCD, as well as the reaction may for some reason trigger the intrusive thoughts to being rich, the rituals, and then also emotional distress characteristics of OCD. Other mental health disorders, OCD may be related to other mental health disorders such as anxiety, depression, um, substance use, or tic disorder. All right. And moving right along, um, when we're looking at risk factors with obsessive compulsive disorder, so some of the risk factors we look at again is a parent, sibling, or child with OCD, physical differences in certain parts of the brain. That's they do a brain scan. Depression, anxiety, or tics, and then also experience with trauma and a history of physical or sexual abuse as a child. Some of the complications with OCD, um, and I missed that, complications of obsessive disorder, complications, which is those should be OCD. Pretty much problems resulting from obsessive compulsive disorder may include among others, but excessive time engaged in a ritualistic behavior, health issues such as basically just basically having different type of dermatitis from frequent hand washing, just contracting that stuff. Um, and then also difficulty attending work, school, and social activities due to the obsessive compulsive disorder, troubled relationships, overall poor quality of life, and then suicidal thoughts and behaviors. So prevention from for oppositional compulsive disorder, there's really no sure way to prevent it. However, getting treatment as soon as possible again may be helpful with preventing from things from getting worse or disturbing activities um, that will disturb your regular daily routine. When we're talking about obsessive compulsive disorder treatments, psychotherapy is one of the big ones. And that one is where you're talking with your doctor, you're talking with your therapist, you're doing CBT, cognitive behavior therapy, to help with your thinking patterns. It's also in a form also called exposure and response prevention. Your doctor will be able to put you in a situation designed to create anxiety or set off the compulsion, excuse me. And then you'll learn to lessen and then stop your OCD thoughts and actions. So that's a process to go through, as well as relaxation, simple things like meditation, yoga, and massages can help with to release some of the stress when it comes on to OCD. And then when we're looking at more treatments, medication can be some of the things that can come into play as well. Definitely talking about taking the medications about 2 to 4 months for to see if things are working. They have medications like Celexa, Lexapro, Prozac, Zoloft, Paxil, and then if you still have symptoms, the doctor might even go with an antipsychotic, the Abilify and the Respidol. And then a lot of times, we go into the neuromodulations. And a lot of times with those, it's basically your doctor might excuse me, your doctor might talk to you about devices that they may use electric activity in certain areas of your brain. So sometimes that might be a deep brain stimulation with electrodes that they implant on your head, and kind of going through those type of services as well. Also, managing obsessive compulsive disorder symptoms might be psychotherapy. Again, talking to your not doctor, I'm sorry, your behavioral health provider, your mental health profession. That's your therapist. You can also talk with a psychiatrist and a psychologist as well. There are several types of psychotherapies mentioned. Of course, I mentioned CBT earlier. I want to talk a little bit more about that. Basically, CBT can help alter harmful thoughts and stop negative habits, perhaps replacing them with more healthier ways to cope, as well as exposure. We talked about the exposure and the response therapy prevention, which is the ERP. Pretty much, it's a type of CBT, cognitive behavior therapy. And basically, again, it's the therapist exposing you to a situation and images that help get to the point where you can resist the urge to a perform a compulsion. So acceptance and commitment therapy, that one's ACT, help you learn to accept excessive thoughts as just thoughts, taking the power away from them. So pretty much an ACT therapist will help you to learn to live a meaningful life despite the OCD. And then mindful techniques such as meditation and relaxation can also help with symptoms. Moving right along, talking about medications again. So medications for OCD, again, talking about those serotonins, those SRIs and those SSRIs, all those good stuff. I don't really get into a lot of the medication part because that's kind of, pretty much outside of my scope of practice because I don't prescribe meds. But yes, talking with your doctor about different types of medications. So basically, from the overview, all of our resources are listed here where we got the information from. And this was just a basic overview of obsessive compulsive disorder and anxiety, but it gives a lot of information to give you a pretty good understanding of what happens and what goes on when we're talking about anxiety, and then we're looking at the obsessive compulsive disorder itself. So I hope you enjoyed this presentation. Again, this is a presentation for supervision, and I hope you have a wonderful rest of your day, evening, or night. Thank you.